Good day and welcome to Alena Media TV. We are broadcasting from Toronto, Canada. I am Elsa Abraham, and in this episode we are bringing you editorial. People are dying at home. Tigray medical services struggle after turmoil of war. Let's go for a quick break. When we come back, we'll get our editorial in details. Stay with us. Welcome back from that break. Accounts from residents, medical workers, and humanitarian groups illustrate people's flight as Ethiopia struggles to revive a heavily damaged healthcare system in Tigray 3 months after fighting erupted between the military and the region's former ruling party, the Tigray People's Liberation Front, the TPLF. Some hospitals are barely functioning, with no water, electricity, or food, they said. Most were looted of medicines. Staff members also fled away. The health system in Tigray is reportedly nearly collapsing. The United Nations Office for the Coordination of Humanitarian Affairs, the OCHA, said in a February 4th report, noting that only 3 of the region's 11 hospitals were working properly. Ethiopia's health minister, Lai Tadesse, said conditions were improving rapidly. The government has sent supplies to 70 of the region's 250 health facilities, along with 10 ambulances, she told Reuters media last week. So many health facilities have been looted, so we are working to get more equipment to the region. The focus is to restore services, supporting health workers to come back and ensure they have the supplies they need. Prime Minister Abiy Ahmed also declared victory over the TPLF 2 months ago, but details of the devastation have been slow to emerge as communications to the region remain patchy and the government tightly controls access to journalists and aid workers. The media has not been able to visit the region and could not independently verify accounts provided by residents and medical workers. Prior to the outbreak of fighting on November 4th, most people in Tigray had easy access to a hospital or clinic, according to the Ministry of Health. The conflict disrupted basic services, including diabetes treatment and maternal care, leading to too many preventable deaths. The International Committee of the Red Cross said in a 27th January statement, 30 of the region's 280 ambulances are still available, according to the OCHA. A woman described searching for the northern Tigray town of Sheraro on 22nd December for pills to prevent pregnancy after a friend told her she had been gang raped by 5 men. Not a single worker was in the hospital. The woman told the media by phone, saying she was too afraid to be identified. The whole hospital was looted. Apart from the roof and the doors, nothing was left. She tried a healthcare center, but said it had been looted also. When French aid group Médecins Sans Frontières, Doctors Without Borders, visited the northern city of Adigrat in mid-December, the hospital was mostly deserted. It said in a statement last week that there were hardly any medicines and no food, no water or money. Some injured patients were malnourished. The group's emergency coordinator for Tigray, Albert Viners, said in a statement. Some services have since resumed, but the hospital still has no chemicals for its laboratory and no therapeutic food for malnourished children. An Ethiopian medical worker stationed there told the media on Saturday he asked not to be identified because he was not authorized to speak to the journalist. Hospitals in the towns of Adwa and Axum in central Tigray also had no electricity or water when MSF visited. All the medicines had been stolen from Adwa Hospital and furniture and equipment broken, Viners said. I saw people arrive at hospital on bicycles, carrying a patient from 30 kilometers, 19 miles away. And those were the ones who managed to get to the hospital, he said. People die at home. People die on their way to the hospital and they are returned back home for burial. MFS is now supporting 4 regional hospitals along with smaller health centers and running mobile clinics in 15 locations. Most rural parts of Tigray remain out of reach to humanitarian groups because of counting insecurity or because they lack permission to go there, aid workers told the media. The TPLF withdrew from the regional capital Mekelle and major cities, but low-level fighting has continued in some areas. Ethiopia's Ministry of Peace said on Saturday that it was moving with urgency to approve requests for international staff movement into and within Tigray to ensure humanitarian assistance is expanded without delay. A team from International Aid Group Action Against Hunger reached a town west of Mekelle for the first time on January 23rd and found it pretty deserted. We want to start having mobile health and nutrition clinics to operate in the rural areas, the group's country director, Panos Novradzis, told Reuters, but added security was still fragile. Staffing at medical facilities also remains a problem. As many as 20 or 30 women were giving birth unattended to daily in the central town of the Shire because the hospital is not staffed overnight. An aid worker who visited last week told the media. Almost all health care workers in Tigray had gone unpaid since the conflict began. A regional government report noted on January 8th, and 3 healthcare workers told the media last week they had still not been paid. Health Minister Tedese said money was being sent to local authorities as quickly as possible. Hospitals in Shire and Axum were functioning again, she said. But although Adwa Hospital remained out of service, help is coming too late for some people. One woman told the media her 55-year-old mother died in Mekelle on December 4th after the family was unable to find insulin. Mebrit, who asked to be identified by one name for safety reasons, said she tried hospitals, the Ethiopian Red Cross Society and other diabetics, but no one had spare insulin to give her. 4 days, she said, she jolted awake each night to check her mother's labored breathing. I was praying to God to bring mercy in the house. The insulin came 13 days after my mother died. This is a very sad story from one person we heard from. This is where we end today's episode on editorial. Make sure you like, share, comment. If you have such a situation in your country, let us know in the comment section below so that we can also talk about it. Thanks for watching.